5-minute crafts, Troom. I've reacted to health hacks from all sorts of YouTube channels. This time, we're taking on Gotcha's medical advice clips. Kids channel, the video got over 100 million views. Let's see if it's accurate. Beep-whoop.
Open your mouth!
Oh my God, is this how my patients feel when I come in to do an exam?
What are we gonna do now? Oh, I know!
First of all, who uses a mercury thermometer still? That being said, a lot of people rely on superficial temps. Those are not accurate. What is most accurate, especially in the pediatric population, rectal thermometer. Like if I had to make a rating system, I would go forehead, ear, rectal.
Are those stickers? They're thermometer strips. Just place one on her forehead. And look, it shows how high her fever is.
I've seen the thermometers that they used to use that were disposable, where you would put it in your mouth and based on the color change, you would be able to read the temperature. Those weren't super accurate, created a lot of waste. Look, children get scared of all sorts of medical procedures, but checking temperature is not one I've run into having a problem with.
Clary's distracted. Quick, give her a medicine pill.
First of all, what is vitamin complex? That sounds like something Gary Brecka would do.
Ew! Well, that didn't work as expected.
Maybe the child just watches our YouTube channel and understands that in most instances, supplements, unless absolutely recommended by a doctor, are useless.
She'd rather eat gummy bears. Gummy bears, huh?
Well, children love sweets, but the hack that I give parents that perhaps Gotcha forgot to mention is that if you don't bring it into the house, they won't eat it. So maybe don't buy it.
It's genius. Why didn't I think of that?
I have a bright idea.
Is she gonna stuff a vitamin inside a bear?
I'm gonna take a gummy bear and slice it open.
Is she really bringing out a medical scalpel? I would never use this knife like this because you're gonna cut your finger. And when your child runs up to you and hits your elbow and you end up stabbing yourself and you need to come see me to check on your tetanus status and get that treated, I'll be there for you.
Will this trick work? Here's a gummy bear.
First of all, screen time. There should be a conversation here about how much screen time we're getting. Kid's like a zombie right now.
She didn't spit it out. Good job, Mom.
Yeah, Mom, you could have done it better. Could have done syrup, there's suspension. Could also put it in an actual piece of food as opposed to the gummy bear. You know, health stuff, health stuffs.
I got a bee sting on my tongue.
Is that the killer bee from the Bee-Nado episode from 911 with Captain Steve?
This calls for a red alert.
I've never pressed that button in the hospital in my life. I don't even know what that button is. It's like the Staples Easy button.
Ooh, what does this button do?
That was easy.
Great, the package is deployed.
I love that it came down in a parachute, but the parachute is completely non-functional, so they added a fishing line.
This pump will fix everything. It's pumping out the sting and the venom.
There is a tool that can be used if used very quickly upon getting a sting, but I would never use it on the tongue. It's just too sensitive of an organ. It's one of the fastest healing organs, but I would not use that tool there. It's for external use only.
It's candy time. I'm not taking that giant pill.
First of all, doctors and pharmacists need to unite against giant pills for kids because they are genuinely hard to swallow. And while there are some tricks I offer to patients, including this one from Harvard Health, I think oral suspension can probably do the trick. You just have to be careful about dosing, which is why a lot of times patients will get their medication with a dosing cup or perhaps a dosing syringe in order to get the right dosage. And it's usually written like 100 milligrams per 5 ml, meaning that in 5 milliliters, which you could pull out with the syringe, there's 100 milligrams of that medicine. So you have to read the label and understand how much you're giving, either based on milliliters or grams or milligrams, whatever the weight is.
Are those Skittles? I have a sweet idea.
What, you're gonna swap it?
I'm gonna throw in this medicine pill among these candies.
Oh yeah, so a random child will get this random giant dose of medicine.
Look, I got you a candy claw machine.
I hope this isn't a diabetes medication, because if it is, Jesus, you're gonna put the kid in a diabetic coma before they get their medicine. This is like Squid Game for kids' diabetes medicine, where they have to eat all the sugary candy and try not to go in a coma before their medicine becomes available.
I want to take a ton of candies. I got one. Yes, come to me. Wow, this candy is huge.
Does the kid not recognize that this is the sole ingredient that's different than all the other candies in the little thing?
I don't want to take the medicine. Get it away from me.
Is this whole thing about kids not taking their medicine?
You take this pill, or else.
Is the doctor threatening patient harm?
He was asking too many questions.
This is like 1 hour of gotcha, and I could simplify it with a 5-second message. Stop giving kids pills, give them oral suspension. I solved it!
Hey, yeah.
I'm turning it into powder.
You have to first realize if that's acceptable for the medicine. Not all medicine can be crushed. Not all medicine should be split, especially if they're in a capsule.
I'm gonna transfer the powdered pill into a bowl.
You kind of lost most of the medicine.
Then I'll add chia seeds. Now pour in some water. I'll add a drop of blood into the mix and start stirring.
Is that ketchup? If I prescribe this child 500 milligrams of a medicine, I think in that whatever she ate is probably like 20 milligrams, and I drastically underdosed her, which is the equivalent of not giving the medicine.
The poor and rich kids are having ear troubles.
The poor and rich kids? External ear infections from like a swimmer's ear happens to all of us.
Let me examine the problem.
Is that a spider toy that's lodged in the ear?
I need that pop tube.
Hey, where's my toy?
Is that a little vacuum?
I'm gonna use the pop tube to blow a huge ball of earwax out of your other ear.
That yeah, it's not. There's no connection. There's a tympanic membrane, and it's not. That's not how it works. What is inside the person's mind who creates this? This is so medically inaccurate. I take out earwax all the time, and yes, it's not pretty, but it's fine. It's earwax, and it comes out the same side that I'm working on, not the opposite side. And I usually just irrigate it out, flushing it out. Maybe I'll put some drops in there to moisten the earwax and soften it so it's easy to come out. I could also have a curette where I actually pull it out, or if you go to an ENT, they could actually vacuum it out. I'm trying to think of a good medical name for the ear condition. Arachnotalgia. Arachnotalgia.
A pimple? Someone's gonna have a bad morning.
Or it's not that big of a deal because it's a pimple and we all get pimples.
Guess I have to pop it.
Do you have to pop it? I don't think you need to pop it.
This is disgusting.
Stop it. Get some help.
It's like Elmer's glue was inside the pimple, which does not make sense.
We could make you a beauty mask. Of course, the face mask maker.
The face mask maker.
Let's add in aloe vera and some water. Is that orange soda?
Why are we putting orange soda and aloe vera into a face mask? That pimple also looks infected. I would probably put some antibacterial ointment on it.
It's almost ready. I want to add glitter and sprinkles too.
Glitter and sprinkles. Great. We're putting PFAs inside of our children's face mask.
You should be as good as new after a while.
No, that face mask doesn't help anything. It does not help pimples. That's going to create more pimples.
Double trouble.
Oh, yeah, exactly. I wonder if the next scene is her going to an attorney and suing. Maybe Legal Eagle's in the next clip. Let's keep watching.
Her poor your skin? I think I know what to do.
Oh my God, she got the cabbage.
This cabbage leaf could be a good face mask.
I have never once, in my 11 years of practicing medicine and 4 years of medical school before that, have ever prescribed a face mask for a patient. And I've treated acne plenty of times before.
Ready? It worked! Look at your smooth skin. Who needs a facial when you have
Cabbage! See, veggies are good for your skin when you eat them.
Eat your vegetables!
There's so much chewing gum. The policeman doesn't even know which one to try first.
Do police people usually use gum, abuse gum?
I want those.
No can do. We're not allowed to feed you. See?
Is that a sign?
This is so unfair.
Poor Charlotte. She deserves a yummy chewing gum too. I know. Mommy is going to fool the policeman. Ew, Mommy, your teeth are so dirty.
You shouldn't lie to policemen, and don't teach your children to lie to policemen. The police officers are there to help you.
Huh? Ew.
Oh my God, she has poo on her teeth, so we need to give her gum. Hey, Sergeant Wilkins, give her that juicy fruit stat.
Can I have some toothpaste?
Here, make sure you use all of it.
Use all of it? Again, a bad lesson for children. Do not use all of it. Pea-sized amount for children.
Let's make our own chewing gum. How is toilet paper gonna help with that?
Oh my God, please don't make chewing gum from toothpaste. Please don't do it.
Tear off a piece and crumble it. Then apply a bit of toothpaste over the crumbled tissue. Ta-da! It's makeshift bubble gum.
I'm gonna send this to all my dentist friends on Halloween to scare them. I mean, I guess if I never chewed bubblegum before, I would assume toilet paper / paper towels with toothpaste on is basically bubblegum.
Oh, it's yummy.
Mommy deserves a high five.
Mommy deserves to stay in prison.
Let's see the results.
Watch out!
Oh, slip and fall. I feel like there's always a lawsuit in every one of these.
Oh! Ouch!
Oh, you fell right on the tailbone. Coccydynia. That's what's about to happen.
Whoa! What happened to you?
I'm drenched in slime.
That's not a medical condition. You don't need to come in if you spill something on yourself.
I have a bad cold.
Is that coming from your nose? That's purulent rhinorrhea. You gotta treat that infection stat with some antibiotics.
It's okay, I'll help you feel better. Is that a TP hat? Go ahead, try to pull one.
The solution to the child's rhinosinusitis, probably bacterial rhinosinusitis, is putting a toilet paper donut-shaped holder thing on the head. Do they know doctors are supposed to treat the condition? There's also an infection protocol that needs to happen. There's infection everywhere.
Sophia seems tense. Can you do something about the doctor? Can you ask her to check me? The doctor doesn't seem at all interested in them.
Yeah, the doctor should be complained about, and there should be a discussion about their work ethic. Oh, they have a little skeleton too. Do you guys see my little friend there? That's Seymour Veins. Get it? Seymour Veins. Our Patreon actually named them. They're in our Discord. We chat. We do a monthly live stream. You should join. The link is down below. $9.99 a month. I don't keep that money. We vote every month to which organization we should donate it to. Fun times. You're missing out. Join.
Excuse me, can you scan my wife's belly? Yeah. Right now? Do you have any money?
Oh, so this is clearly an American physician.
Money? No, we don't have any. Ah, no money. Here, then check the belly yourself.
How are you going to check the belly with a magnifying glass? You're not checking the skin. You're trying to look inside the belly with an ultrasound.
Hi.
Oh, hi, Daddy. Hi, Mommy.
Scratch all the lawsuit jokes I made earlier. Dell should sue for the fact that they are leading people to believe that magnifying glasses wirelessly connect to monitors and show the internals of a baby. Do you know how expensive ultrasound probes are? Look at this. This is on eBay.
Clary seems to be having trouble with her breakfast.
Is she eating an egg with a chopstick?
It's hard to pick up the egg with chopsticks. Now the egg's rolled away.
Oh, that dog was really cute, but I think this dog's cuter. Rib, come say hi to the camera. Come say hi. We're doing a gotcha fact check. Oh, this is Rib. Look how big he's gotten. He's just a monster mammal now. Show how bright your smile is. Cheese.
There you are.
Oh, that's why we don't chase eggs. Passover joke, right? They do that with eggs.
Passover?
Easter eggs. Easter egg hunt. Sorry, my inner Jew took over.
What happened? Oh dear, there's a bruise.
I would suspect child abuse or something if that bruise showed up in 5 seconds and they try to blame it on the egg hunt.
Mom is doing the egg trick to heal the bruise.
Oh my God, did she just really put the dirty egg on her face?
Tap the egg around the area while the egg is still warm.
Warm? You're gonna put warm on a bruise? It's the opposite. The reason there's a bruise is because there's burst blood vessels. And when you put warm on burst blood vessels, they bleed more. Gotcha. Oh, maybe that's the thing. They're lying to you about the medical.
And the bruise is gone.
This is a full-on lie.
Always lying to me too much, lying so much.
Ow!
Both kids hurt their arms from falling.
Oh my God. What are these genius doctors with their gold watches and fake wigs gonna give them?
Take a seat and show me your arm. We'll do an x-ray. Uh-oh, you...
That's a ridiculous fracture from falling at the level they did. If I saw a fracture like that from a fall from 1 or 2 feet, I would be concerned that the child has some sort of bone disorder leading to fragile bones, rickets or something.
Nasty. Is that Thanos' Infinity Gauntlet?
I don't know why that matters.
Whoa, this is so cool!
Don't forget your golden sling to hold your arm.
Wow.
An infinity arm sling.
The child needs emergent open reduction internal fixation surgery because the bones are malaligned. But he put a Thanos glove. This is by definition malpractice. I also react to Nickelodeon medical scenes. Click here to check that out, and as always, stay happy and healthy.